My name is Henry Mangala, the Country Program Director for Ghana Cares. Because of the beginning time, I think I'll focus on this address from here. So, ladies and gentlemen, I welcome you to the 6th National Health Financing Conference 2024. Strategies and models for creating self-sustaining health in Uganda. Just as our chief facilitator this morning, I also commend the leadership of AGA, certainly led by Edith Vladia Mukama, and the committed organizing partners. As we go through this conference, it's important that we make reflection and remind ourselves of the several actors in the community health system service delivery. Of course, we have the private for-profit organizations. And we have a range of these actors from the traditional birth assistants. I think none of them works for free. They are there for profit. Okay, there are those for community service, but we know that they are there. The complementary medicine practitioners are also there. And then we have a wide range of individual private clinics, drugs, and pharmacies. So that also constitutes the community health system that we have in the country, because they interact with our communities, they serve a community. Secondly, we have the private non-for-profit organizations, and this is where I have the wide range of CBOs, NGOs, and I'm glad that most of these are involved in preventive health service delivery.
What does the National Community Health Strategy entail? And it's also to remind us that the National Community Health Strategy speaks to community health system strengthening. It's the strategy that is made to strengthen the community health program. And when we talk about the community health program, we are talking about the NDP 403 line of now program-based budgeting and implementation of government programs. But also we are talking of the other arm of the ministry. We know the Ministry of Health has two service delivery arms. It has the facility and it has the community. So community health service delivery arm is supported or directed by the National Community Health Strategy. And also this is to remind us that whoever is in this hall or room, as long as you're contributing to the community space, the National Health Policy and Strategic Plan wants us to do two main things for the last 5 years and also for the coming 5 years. They want us to strengthen or increase our community and household demand for health services, but also at the same time build systems that are resilient and will be able to withstand any public health concern if we are to have a healthy and productive community and citizenry. And also, it reminds us of the 7 building blocks. These are the WHO health system building blocks. For us as a country, the National Community Health Strategy speaks to the 7 community health building blocks. I usually feel bad when people just pick one building block and capitalize on that. They pick on community health workers, forgetting that community health workers cannot work alone if there is no medicine, if there are no finances, if the systems and the structures that coordinate the community health are bad, if the citizens themselves are not within the struggle or are not in support. So basically this is to remind us that all these 7 building blocks must move if we are to have a stronger community health system.
Roles, reducing their disposable income, and impacting access to health services, including sexual and reproductive health care. The drought led to food shortages, particularly affecting vulnerable groups such as pregnant women, breastfeeding mothers, and children under 5. Some people living with HIV abandon treatment, risking drug resistance due to poor adherence.
I'm called Apollot Christine. I am a teacher by profession, despite the fact that I'm in Parliament right now. Please register apologies. Today has been a very busy day for us. I was the Deputy Chairperson of the Committee of Public Service and Local Government the last 3 years. And as one person was talking about early health-seeking behaviors, I also ended up in a certain health problem. And so for about 6 months, I was not active in Parliament, so I did not apply. I was changed to the Committee of Natural Resources and Environment, and our bill on rationalization was supposed to be tabled today. Unfortunately, at 3, when we were supposed to have the bill tabled, our line minister was not present, and so they ended up postponing it. So apologies for joining late, but I'm informed that our chairperson of the HIV committee was here. So currently, I am a new member of the HIV/AIDS committee, but also in Parliament, I'm the deputy chairperson of the Malaria Forum. And right now, we have a forum that is also busy collecting children's voices on malaria. I think in the near future, like we have been doing, we can also have a situation where we register children's voices on HIV/AIDS.
About the issue of community health financing, I'm very happy that we have come up with this, and I hope it will be consistently implemented, because outside there, community health is very important. And I want to thank the government for implementing most of its programs through VHTs. This community health actually brings in things like healthy eating, clean environment, togetherness, disease prevention, lifestyle, personal audit, because the way we eat, the way we behave, actually either kills us or prevents us from getting some diseases. Yes, the health sector is mad with a number of challenges, and one of these is the funding gap has been so big. VHTs have been interacting with VHTs in my constituency. Most of them, their money comes very late. They don't have gadgets for using, and they don't have transport. They don't have communication gadgets. They don't have drugs to even give the people. And yet some of the diseases which can easily be treated, like malaria and others, can be prevented if the National Drug Authority provides them with enough drugs. Absenteeism of the health workers in hospitals, and finally, issues to do with the distanced health facilities. So I think that when you find these communities, especially the community health teams, they will be in a position to assist us in the prevention of disease. As my colleague has alluded to issues of HIV infection in the country, because we belong to Committee of HIV and AIDS, the prevalence rates in areas where there is less circumcision, especially in Uganda and Western Uganda, is very high. When you go, the regions with the lowest level of HIV infection is Yumbe, Amulata, those areas in West Nile where there is circumcision, Yumbe, those ends, and then by the region, at least there is low prevalence rates. So the HIV, I'm worried by the lady who said that we are going to prevent HIV/AIDS we are going to stop by 2030. I think it's a dream, maybe yet to be realized. Because there are areas, since I came on the Committee of HIV and AIDS, the prevalence rates were low. Now the surge has gone, especially in the Greater Masaka and Western Uganda. It is extremely high. Why? It has gone with the standards of living, and the money factor, and then the nature of cultures in those areas where they share women. Here in Western Uganda, one woman can serve the whole clan. if a man is not there, you can serve the others who are around. Don't starve. Now, such kind of lifestyle has increased HIV infection in those areas. But as a parliament, I want to commit that we shall be supporting all these programs which will come before us, either in the Committee of HIV or in the Committee of Health or in the Committee of Finance, so that we can see that our country is free from disease. But I want to emphasize lastly that much as we can do all this, we need public health is very important, whereby we need to look at how do we behave. I've been moving around in many countries in the Arab world and other countries, but HIV infection, actually they don't have HIV. It's Uganda which is persistent having this HIV. I'm very wondering what could be the problem. Is it because of low levels of education? Is it because of poverty? Is it because of what? But I think together we can. I know by the end of 2030, I want to join you. The lady, I don't know your title, either from which organization, but we shall join you in the fight against HIV, and especially people who come from the islands.
Declare the 6th Annual National Health Financing Conference opened. Thank you.
So there are markers there for signing off the project. Please don't ask us for the money, just join us in implementation. The project will also need supplementary funds. The partners here, if you have more funding, you can supplement the implementation of the project. National Planning Authority, I saw a representative here. The members of parliament here, please join us to launch this project. I see the chair for HIV committee. This is an instrumental project. Do you want to say a word? Okay. So thank you very much, members, for joining us. I'll request those who are here to stay. We are going to have a group photo in memory of this day, and then we will be heading into the next sessions for the day. So that means we will be inviting every one of us to join us here for the group photo. The team organizing the group photo, please.